We have Dr. Nauman Imami again. I told you he's the chief of the glaucoma service at the Henry Ford Hospital, a former director of the residency program.
Assalamu alaikum, everyone. I want to thank Babar and the organizing team for asking me to speak to you guys today. And a lot of what Dr. Zaire said is absolutely correct. I'm going to maybe provide some of a different perspective, and I actually think back up and support what he mentioned. Now, the first thing we need to realize is that we have to look at reality when we're choosing either private practice or academic medicine. I mean, don't watch Grey's Anatomy in private practice and say that this is what life really is. I mean, you got to go out there and see how things are on the ground so you can make an educated decision. Now, no matter what we do, I think it's very important that we always remember what a privilege and honor it is to be a physician. And we've always heard this quote, and I think it's just highly relevant wherever we go. You know, whoso saveth the life of one man, it shall be as if he had saved the life of all of mankind. And as physicians, God has given us the opportunity to potentially save a life or to save many lives or be involved with that process. And we should never forget the honor and the privilege that we have in this role. Now, as an ophthalmologist, I have to give a little bit of a plug here. I mean, I am not involved in saving very many lives, but we do work on eyesight. And Imam Ghazali, who, as you know, is a famous Islamic scholar, he commented that eyesight is our most important sense. And in the Quran, there's an ayah, and Allah has brought you out from the wombs of your mothers while you know nothing, and He gave you hearing, sight, and hearts that you may give thanks. So we must always give thanks to our Creator in whatever role we have. Now, if we focus on academic medicine for a moment, what is academic medicine? Well, in part, we're research factories. We like to create new ideas, new cures, new ways to take care of problems in medicine. Now, we all hope that, you know, God willing, one day we'll be winning a Nobel Prize, although that's not very realistic. But if you do look at the list of Nobel Prize winners in medicine, the overwhelming number of those would sort of be on the academic medicine side. But those of us who are not quite at that high of a level of research can still contribute. And this was a study which I was involved in regarding the ocular hypertension treatment study. And not only was it published in multiple academic journals, but it changed the way we take care of patients with borderline glaucoma. It was even published in the lay press of the New York Times. So all of us at some level can have an influence on the future of medicine. The other thing academic medicine provides you is a fellowship or a connection between the past and the future. There has to be a balance between academic medicine and private practice. If everyone goes into private practice, there will be no future of medicine. We are the ones who help train the medical students, the residents, and keep this commodity or this option available for society. Without training the next generation, there will be no future physicians. But at the same time, private practice serves a critical need to society. I mean, in some ways, those of us in the ivory towers come up with these solutions, but it is the doctors on the ground who actually implement these solutions. So there are many, many, many folks around this country and around the world who need health care. And if it's not for the private practitioners who provide that care, those patients will not be taken care of. Now, this is sort of the traditional paradigm, right? If you're an academic physician, and I'm from Detroit, so I'm going to say you're going to drive a Ford. I could put a Toyota Camry up there as the other option. But, you know, again, we have to support the American economy. So we'll be driving Fords, and maybe if you decide to go into private practice, you'll have this great salary, and you'll get to drive this nice, sexy Porsche up there. But that is really a small slice of the big picture. And if one makes decisions on thought processes like this, one is unlikely to be happy in the long term. So there are many differentiators between what private practitioners do and what academicians do. And you really have to look at this from all of these criteria and see what fits your personality or what makes you happy. You know, if you like autonomy, private practice is probably better for you. If salary is a huge issue for you, although no doctor starves generally speaking, and thank God we can take care of our families, but if income is a huge issue, then maybe private practice is better. If you want to carve out time, you may be able to carve out time as a private practitioner, but you can also do that as an academician. If you're interested in taking care of the most complicated cases out there, generally speaking, that does come to those of us in academics. If you're searching for notoriety or fame, maybe academic medicine can provide that to you. If you want to be involved with innovation, academic medicine gives you that opportunity. Collegiality, we have many, many colleagues we work with every day. And some people would put up security there. And I think that, you know, there really is no security outside of your ability to work in your faith in God. So don't think that if all of a sudden you work for the university, you have a job for life, you have a paycheck for life, you don't really need to worry about security. It's really about what you can perform in any setting in which one functions. Now, I'm going to talk a little bit about salary and a little bit about satisfaction in a moment. Now, you can see that there's a definite correlation between medical student choice of residencies and the relative reimbursement amongst those residencies. So this is a graph showing the percentage of residencies filled by American medical graduates. And you can see orthopedic surgery is the highest on this list. And it doesn't happen to be rocket science that there's also an association between that and a high level of reimbursement. And family practice, as important of a field as that is, the reimbursement levels tend to be lower. So this tells us that income is a driver in our specialty choices. But satisfaction should be a driver also. Now, this is the list. I'm going to show you two slides of a survey looking at specialties and what makes people happy, or how are they satisfied. Now, dermatology, understandably so, tends to be very satisfied as a group. But if you look at it in the big picture, it's only 64%. Would I choose the same specialty again? 68%. Would I choose medicine again as a career? Is only 52%. And this is the best of the best within this survey. So if we don't go into medicine for the right reasons, and if we don't choose our form of practice for the right reasons, there's going to be frustration. Now, no offense to my previous speaker, but for some reason plastic surgery is down at the bottom of the list when it comes to physician satisfaction. And would I choose medicine again as a career? 35%. So I think Dr. Sia really showed us the importance of doing things outside of medicine and being realistic in what your career is in order to get the big picture together to really be satisfied with what you do. But I think it shows us that drivers based primarily on income are not what's going to make you necessarily happy in the long term. But keeping that in mind, and this is slightly older data, and it doesn't matter what the individual numbers are or what survey you look at, the bottom line is there's almost always a delta between academic medicine and private practice. And you need to understand that you won't be earning as much, generally speaking, in academic medicine. But that's really not the only variable point here. It's also a matter of how you are employed. So if you work in academics versus private practice, that's one way to sort of parse this data. But just because you're in private practice doesn't mean that, you are your own boss. You may be an employee, you may be an independent contractor, you may be a partner, or you may be an owner. There are many different forms of private practice, just like there are different forms of academic medicine. So this is not a clear-cut dichotomy, and you'll see that there are going to be gray zones. Now, again, don't look at the absolute numbers because they may be totally wrong, but the concept of the differences are what's relevant here. In 2004, if one was looking to be a dermatologist in academic private universities, there's a delta, but the delta is not huge. If one was looking at academic public universities, that one would say is probably an unrealistic difference in salary that many people wouldn't be willing to accept. And academics is understanding this, but this also doesn't mean apples to apples that the academic guy is a 5-day-a-week full-time doc. Many of these people are sort of part-time clinicians or part-time doctors.